Hi, my name is Zerby, and I'm part of the SSmart team. Given the millions of surgeries occurring annually in the United States, opioids remain important to help patients with pain management. However, this type of post-operative opioid use is something that hugely contributes to the ongoing opioid crisis. Self-management strategies, along with guidance by health professionals, have been shown to help patients with their pain and daily functioning, which is why we've built SSmart. SSmart is an early intervention tool to track opioid use and evaluate a patient's daily functioning post-operation. SSmart particularly helps veterans with their remote health monitoring in an efficient way, something the VA, Department of Veterans Affairs, hasn't done before. The goal of SSmart is to help both the patient and health provider be better informed about opioid use, minimize patient readmittance, and improve patient quality of life. SSmart consists of two parts, an iOS application and a web application. The iOS application is patient-facing and helps the patient keep track of their pain, general health, and medication use, whereas the web application is clinician-facing and helps the clinician understand and evaluate trends in the patient's health. Currently, SSmart is being used as a tool in a research study to prep it for more widespread use.
Welcome to the SSmart mobile app. Patients will use the mobile app to fill out surveys about their post-operative symptoms. Physicians can view this info on the web app. First off, we have the Daily Active Survey. The Daily Active Survey is used to gauge the patient's daily activity and assess patient pain. These surveys are designed to measure the patient's symptoms and medications taken. Each survey takes approximately 2 minutes to complete. Let's look at the active survey. First, we have a mood question in which patients can answer how they're feeling today. There's an overall health question, and we have a pain rating question in which patients have a broad selection of pain and emotions, and they can select how they're feeling. We have a pain localization question in which patients can address where they're feeling most pain. SSmart also has a very interactive UI. Patients will have a progress bar in which the more they interact with the app, the higher their score is. Patients can view their score over here, which is 20 points. If the patient wishes to withdraw from the study, they can simply click on the withdraw button and withdraw from the study.
Welcome to the SSmart web app. When the physician first logs in, they are met with an overview of all the patient's activity. Based on a patient's symptom severity, as recorded in the FARSTAR database by the mobile app, our dashboard automatically assigns each patient with an importance score, representing the urgency of a check-in for that specific patient. Ultimately, this allows doctors to quickly assess their patients on a uniform level and streamline their daily schedules. At the bottom of the page, there's a section about patient survey interaction, which the physician can reference to understand each patient's involvement, which represents the percentage of total surveys completed. All the way at the bottom, we have a downloadable data button, leveraging both Google's BigQuery as well as Cloud PubSub. Now let's move on to a patient-specific page, starting off with surveys. At the top, we have general information about the patient, starting off with the pain score, as well as some medication data. Down below, we have some surveys which track a bunch of different conditions over time. These visualizations, along with the medication information, will allow physicians to quickly and easily understand opioid usage amongst their patients. And once again, we have downloadable data feature at the bottom, which leverages the same services. But this time, the data is patient-specific as opposed to all the data. Both applications are built off the Cardinal Kit framework, which leverages Google Cloud, a HIPAA-compliant backend, and Apple's ResearchKit, CareKit, and HealthKit, ultimately ensuring complete privacy over a patient's data.